The educational session was really bringing the audience up to speed with what would be considered sort of standard of care today for patients with mantle cell lymphoma. So I covered all the frontline therapies, not just for young patients but also for older patients, and just explored the evidence behind what we do and the potential direction of travel for the future. So it was basically providing the evidence to support using high-dose therapy for younger patients as consolidation of remission induction, using high-dose Cytarabine in a different number of different ways. It probably doesn't matter how you use it as long as you use it before a transplant. And then in the older patients, the comparative data between CHOP-based and bendamustine-based therapies. And I think broadly there isn't much to choose between the two. There isn't definitely one better way of treating older patients than another. My personal view is if you're a fitter older patient, then I'd prefer a CHOP type therapy. If you're not quite so fit, then a bendamustine-based therapy I think is probably the way to go. They're broadly comparable. So that's what I was largely talking about. And then what's the impact of novel agents going to be on that treatment paradigm? There are a number of studies running right now that I think are going to impact reasonably quickly. I think there's no question Ibrutinib is going to come into the front line in elderly patients first, maybe in combination with bendamustine Rituximab or maybe just Rituximab alone. In younger patients we've got to be a little bit cautious because we know high-dose Cytarabine-based therapy and a transplant gives some very, very durable long-term remissions. We don't know what long-term remission looks like in the novel agent era, so we've got to be a little bit careful that we don't try something brand new when we know what's established works well. Chemotherapy works. I mean that's an obvious message for younger patients. For older patients, I think the toxicity versus efficacy is a slightly different, it's a different equation. So I think for older patients, new drugs are going to come in early. For younger patients, I think not yet, but soon, I think.